Hi there, Dr. Lauri Brouwer here. I am doing a presentation for you today on dietary fiber, and let's just get started with the slideshow. So dietary fiber is our conversation today. If you have any questions, if you want to raise your hand and ask a question, please feel free to speak up in the chat. I will probably hold questions until the end, but I'll go ahead and get started with our conversation now. Okay, why do we care about dietary fiber? This isn't something that sounds really sexy or interesting to talk about it. Most people, though, really don't even understand what dietary fiber is, and it's really important for our overall health as humans. So some of the things that dietary fiber contributes to our overall health is protection from certain disease states, right? So digestive system diseases include things like cavities, which we call in the medical field dental caries, gallstones, kidney stones, diverticulosis, diverticulitis. Now, there's some trickiness around dietary fiber when you do actually have diverticulitis flare-up, but preventing diverticulosis in the first place is one of the functions of dietary fiber. Conditions like ulcerative colitis, irritable bowel syndrome, and Crohn's disease can also be prevented or diminished with good dietary fiber. Appendicitis and colon cancer also are related to a low dietary fiber intake. So having good dietary fiber protects us from a lot of things directly related to the digestive system that those fibers go through. But other things like metabolic diseases, obesity, diabetes, and gout, those can all be prevented or reduced through good dietary fiber intake. Cardiovascular diseases, hemorrhoids, which we would generally think of, but it is a disorder of the blood vessels. Varicose veins, those can be impacted by having good fiber intake to keep your body generally healthy. We can help prevent cerebrovascular disease, which is also known as a stroke, hypertension, which is high blood pressure, pulmonary embolisms, and ischemic heart disease. That's the kind of heart disease where a clot or an embolism will block your arteries and stop the blood flow. So those are some of the cardiovascular diseases that are able to be prevented when we have a really good dietary fiber intake. Our skin is going to be in much better condition when our gut is healthy, and our gut needs to have dietary fiber to be healthy so we can improve our skin, ashes, acne, rashes, things like that. Autoimmune diseases can also be benefited, delayed, prevented with dietary fiber. And then hormone imbalances, importantly, when our body is eliminating and clearing the hormones that it uses, they've done their job, and now we need to get rid of them and eliminate them. Dietary fiber is a really important piece of the process of that hormone being eliminated so it doesn't recirculate through our bodies, right? I do have a caution there, and I'll mention this again in just a little bit, but there can be some caution with adding dietary fiber to a diet if somebody has IBS-D or some certain other conditions. I do like to always mention to you, I'm a naturopathic doctor. My patients are used to working with naturopathic physicians, and we generally discuss the therapeutic order, right? That's one of our foundational doctrines in naturopathic medicine, is there is a therapeutic order in order of priority and efficacy. And where dietary fiber fits into our therapeutic order is right at the top. It's at the establishment of conditions for health, right? Instituting a healthful regimen of how you eat, drink, move, and think. Dietary fiber is right in there, and it actually does include some drinking too, because if you increase your fiber intake, you do want to increase your water intake. Having good dietary fiber can stimulate the healing power of nature, can address weakened systems if they were harmed by a low fiber diet initially. We'll talk about some of the terms. I'm calling them categories of fiber here, but these are terms that I'm going to talk about throughout this presentation, and you've probably seen these if you've ever looked online or read anything about dietary fiber. These are some of the terms that are used, and I'll describe them for you. So a soluble fiber is paired there with an insoluble fiber, right? Soluble is a type of fiber that will form a gel when it's soaked in water. Insoluble fiber won't do that. The good thing with those soluble fibers, some of the benefits for us is they reduce our blood sugar levels, They reduce our cholesterol and other lipids like triglycerides. And those are the type that can bind the hormones for elimination through our gut, through our bowel movements. Insoluble fiber, that one, it's not something that forms a gel in water. They're usually tougher. They require more chewing. That increases saliva production. That's better to protect our tooth enamel. That's one way we can help to prevent cavities in our teeth and to digest our foods better. And chewing is also one of the functions that stimulates a calming response in our autonomic nervous system. So the longer you chew your foods at each meal, the more it can help your body to calm down. So soluble and insoluble are one category. And then the other would be fermentable or non-fermentable. Well, the fermentation is done by gut bacteria. So fermentable fibers are those that can feed our gut bacteria. And that's fantastic. Everybody, I think, has heard about probiotic bacteria, and we know that they're really required for us to have a healthy functioning gut. And when we have fermentable fibers in our diet, the slower fermentable fibers feed those probiotic bacteria that live in our large intestine and our colon. And more proliferation of that bacteria, more of those guys in your colon will increase the bulk of your stool. So it's like it acts as a stool softener, so your waste can be more rapidly eliminated and more thoroughly eliminated. And that's actually one thing that a lot of people don't know, is that much of our actual stool that we pass is a very, very high percentage of the stool that we pass is gut bacteria, and then the cells that line our colon. So it's like shedding our skin. So much of what is passed through our stool is the healthy gut bacteria. So increasing their population is always a good idea. Then the rapidly fermentable fibers, they're a little different. They're going to be fermented mostly up in our small intestine, and then be used for energy by the large intestine cells, the colon cells. Also, some of these short chain fatty acids, or SCFAs, that are produced, those can be used by our body for energy, right? So the colon cells themselves can use butyrate to create energy from. Propionate is used by the liver for energy production, and then acetate goes out into our circulation, and the rest of our body can use that for some energy production. One terrific thing about propionic acid, or propionate, is that when it goes to the liver, it also helps the liver to manage the function of lowering cholesterol production. So fermentable fibers have a multitude of benefits to our body, mainly through the activity of feeding our gut bacteria and letting them help us. Non-fermentable fibers, they're not going to impact the gut bacteria in any way. They just increase the bulk of our stool and soften it. So again, we can just move waste out more efficiently. Okay, so when we talk about the different fibers in this presentation, we're going to talk about them being either soluble or insoluble, and fermentable or non-fermentable. And so you can kind of estimate the benefits of them just from this slide. FYI, I do have a handout that I present to my patients, and that handout has pretty much most of everything that's going to be presented in my talk today. So if you would like to get a copy of my handout about dietary fiber, I'm happy to share that with you. Just reach out to the office and let us know you'd like that. Different fiber types. What I'm talking about in this presentation today is dietary fiber, and those include non-digestible carbohydrates that are naturally found in intact plant foods. So some of the types of fiber are called cellulose, hemicellulose, mucilage, pectin, inulin, algal polysaccharides, and lignin. So those are things that are found in foods that when the food is intact, that fiber will be there. And functional fibers is another category of fiber, but these are things that are manufactured and they're isolated compounds. They do confer beneficial effects, but I'm not talking about it in this presentation because they're not dietary fiber. They're not something you're going to get from modifying your diet, which is really the focus of this talk today. Fibers from food, again, Another encouragement for you to get your fiber from food is that studies demonstrating the benefits of fiber in the diet have primarily been done using whole foods as the study intervention, right? Researchers note that it's difficult to separate the effect of the fiber per se from the high fiber food. And that's because the fiber may be giving, the majority of the benefit, but definitely other things come along with those foods like vitamins and minerals, and other nutrients, maybe even some proteins. So it can't be surmised that it's entirely the benefit of the fiber itself, but the food that the fiber is in as well. All right, I'm going to dig into all of those different types of fiber I listed on an earlier slide. So we'll just kind of go through each different one, tell you information about it, the benefits it yields, and then where you can find these great types of fiber. All right, pectin's one of my favorite fibers. If you're a home cook or if you've ever made jelly, you'll know that pectin is the substance that we add to our fruit juice to help turn it into a jelly. And pectin is naturally occurring in fruits, so we don't always have to add it. Sometimes we can just make jelly by boiling down the fruits with some sugar or maybe some lemon juice, and that'll turn it into a gel. So, and because it gels, that it's in the category of soluble fiber. So pectin is a soluble fiber, it gels, it's rapidly fermentable, so that means it is mostly going to have its action in our small intestine. Okay. The benefits are that it decreases fat absorption from the foods that we eat. It delays glucose absorption, which means it reduces the blood sugar spikes after a meal. And so your insulin will function more appropriately. And we can avoid that insulin resistance by keeping that blood sugar managed and entering our bloodstream very slowly rather than rushing in after our meals. So if you've got pectin in that meal, it's going to help slow down the other simple carbohydrates. So lowering cholesterol in our bloodstream, another great benefit from pectin, and chelating heavy metals to remove them from our body. Chelating just means that the heavy metal is an ion, and the fiber is going to grab onto it and bind it, and then it's going to go out through your bowels, which is where this fiber is, right? So any heavy metals that are in there, it's going to grab it and allow it to be removed from your body so that those heavy metals don't get absorbed into your bloodstream or your body tissues. All right. So pectin, great, really wonderful benefits from this particular type of fiber. And it's in some really, terrific, delicious foods. So all sorts of fruits, apples, strawberries, apricots, cherries, plums. This isn't a comprehensive list. This is just to give you ideas. You can look these up on many online sources, but these are some ideas. Citrus rinds do contain pectin. There's actually a treatment that's available, a medical treatment. It's called modified citrus pectin, and that's been used to have been shown to have some anti-cancer effects and can be very beneficial to our bodies. But yeah, that just comes from the citrus rinds. I don't know if you ever, consume citrus rinds, but whenever I get, say, lemon, I make lemon chicken at home. I make sure to put the whole cut slices of lemons in there. Or if you go to restaurants that serve you like lemon chicken that have the actual citrus rind in there, eat it. It's got some good fiber in there. It's pretty tasty too. It's kind of benign flavor. Cabbage, cauliflower, dried peas are going to have pectin, and green beans, carrots, potatoes, and squash. Those are some of the sources we can get pectin from, and it has a multitude of benefits for us. Mucilage, what a funny name, right? Mucilage is not something that's really in a lot of foods that we eat other than legumes. And legumes are the category that includes beans, peas, and lentils. Peanuts is in that group. But mucilage benefits us by being one of the soluble fibers. It turns into the gel. It's rapidly fermentable, so it's going to be mostly fermented starting in the small intestine. With this type of fiber, it can decrease the absorption of fat from the foods that you eat, which on one hand can be a great thing, so that we don't get too much fat in our body and we don't have, just too many calories. But be mindful, we do have a lot of fat soluble vitamins that we only will absorb the vitamin if we also absorb the fat into our bloodstream. So you don't want to go crazy with things that decrease absorption of fat from foods, but this is a great thing as a regular, average sort of serving size in your diet can be beneficial. And delaying glucose absorption, again, is one of its benefits, lowering cholesterol. Delaying stomach emptying time. Sometimes we call this delaying gastric emptying. And what that is just it makes you feel full longer. So if you have a meal that's full of fiber from mucilage, like beans and peas, it makes you feel full longer, so you're not hungry nearly as soon. And it's another one that can help remove toxic metals from our body. Algal polysaccharides. Here's another weird one that's probably not in everybody's daily diet, but it is in things like seaweed, spirulina, kelp. So if you're somebody who eats a lot of Asian foods or snacks on seaweed, then algal polysaccharide is the type of fiber you're getting from that. It's another good soluble fiber that's rapidly fermentable. Again, small intestines mainly where it's working. The benefits of this type of fiber are laxative. It has a laxative effect. It also delays your stomach emptying time, so you feel full longer and can rid your body of heavy metals. Hemicellulose. This is another really important category. This one, it varies whether the food is going to be soluble fiber or insoluble, and it is moderately fermentable. So it's going to have actions in a couple of places, not just your small intestine, but now we're seeing a benefit for the small and large intestine, or also known as the colon. So this one's the first one we're seeing that has action in two places. It's really good for increasing the size and bulk of your stool to improve your elimination. It's a good substrate for your bacteria to produce those short chain fatty acids that I mentioned earlier. So the butyrate, propionate, acetate, which provides energy sources for our liver, for our colon, for our body overall. That's something that bacteria can take this sort of fiber and produce that benefit for us. It also helps to lower cholesterol. Sources here, lots of seeds, chia seeds, flax seeds. This is where whole grains really kind of shine. Whole grains, oat bran, whole wheat, wheat bran, things like that are going to be helpful to contain the hemicellulose. Brussels sprouts, mustard greens, those are also in the family of brassica vegetables, sometimes called, oh, my brain just shut off for a second, guys. Anyway, brassica vegetables, like Brussels sprouts and mustard greens. Beet roots, not the beet greens, but the beet roots will have hemicellulose in here too. Cruciferous vegetables, it just came to my mind. So Brussels sprouts, mustard greens, they're called brassica or cruciferous vegetables, in case you've heard those terms before. All right, moving on. I've got a couple more to talk about. I'm not going to get too in the weeds in the details, but I'm just going to hit a couple more types of fiber. Now there's cellulose. Cellulose is an insoluble. So it's the first one we're seeing in this category that's an insoluble entirely. So it doesn't gel. It's just one that's good for kind of making things tougher to chew. So it can benefit our teeth in that way and benefit, that calming if we sit and chew these foods. In grains, the type of fiber from a grain is a non-fermentable type, but if it's in legumes, from beans, peas, and lentils, then that can be fermented by the colonic bacteria. Mostly works in our colon. When we eat a lot of cellulose, it promotes proper function of your colon by absorbing water to increase the size and bulk of stool, which is how, again, the previous slides that said increasing size and bulk of stool, same thing is happening here, helps to prevent constipation. And it decreases the transit time, meaning it kind of speeds up things being eliminated and moved out of our bowels. So, any of these type that are bulking are great for relieving constipation and getting rid of waste more efficiently. This one also can be fermented by the gut bacteria, at least when it comes from legumes, and turned into those short chain fatty acids. There's a really wide variety of foods that contain cellulose. This is a major structural building block in plants, and so it's in a lot of plant foods. It's going to be in the seeds we talked about before, in whole grains, again, legumes, cabbages, other brassica vegetables, broccoli, Brussels sprouts, different kinds of beans, even if it's not the hard dried beans, young beans, green beans, things like that are going to have cellulose. Cucumber skin. So if you're somebody who's in the habit of peeling the cucumber skin before you slice up your cucumber, you're getting rid of some really important fiber there. So, eat the skins if If it's an organic food, if you've washed it, go ahead and feel free to have the skin because that's going to be a nice source of fiber. Peppers, carrots, apples, those are some other things. So cellulose is abundant and everywhere and really good for us. Inulin, now this one, it doesn't have a multitude of benefits, but it's a really important food source for our gut bacteria. And it's found mainly in things like artichokes, asparagus, leeks, onions, garlic, jicama, chicory root. That's not something people generally eat, but dandelion root and chicory root can be made into teas. And since this is a soluble fiber, that will be extruded, into the water. And so you can drink them through teas. Bananas are really high in inulin. So when I am, encouraging patients to eat more onions and garlic and things like that, if you don't tolerate that well, if you get, gassy and burpy and bloated when you eat onions and garlic, that actually tells us you might have a disorder going on in your intestines where it can't tolerate this fiber. But otherwise, it's a really, it's a terrific fermentable fiber. It's mainly, it's there to feed our gut bacteria and keep them happy and healthy. I think this may be the last fiber we're talking about, lignin. This one is one of those insoluble fibers. It's not fermentable. It's something that just really goes through, I think my grandma would have called this roughage, right? It just goes through and kind of helps to bind onto things and clean things out. But there are also some antioxidant effects with lignin and anti-carcinogenic or anti-cancer effects. So I haven't seen those terms with the other sources of fiber before. So this one's a special one. We do want to make sure that we're getting the lignin in. That is something, sources include, many of the same we've seen before, the seeds, the grains, older vegetables. I just want to mention that. That would be, instead of eating the little baby corns, eat a full-size corn. Instead of having baby spinach, eat fully matured spinach. So the little, spring grain mixes are really delightful to make nice salads with, but they're lower in some important fibers than the fully mature version of those greens would be. So older vegetables will contain more of this than the young ones do. Fruits, veggies, beans, all sorts of great things contain this. Now, moving from the knowledge of all of those different types of fiber to the benefits of them, just to see if you have a specific benefit you're looking for. Again, if you get the handout that I've produced, that handout has a page with this information on it. So, if you find this a beneficial slide, you can have that information through the handout. But, the benefits we talked about at the very beginning of this presentation, binding hormones for elimination. These are the specific fibers that will do that. Delaying glucose absorption. So if you're trying to improve your blood sugar and insulin ratio, you're trying to get your insulin down, reverse, an insulin resistance, this is something you're going to want to get a lot of is mucilage and pectin. Problems with cholesterol, maybe yours is a little bit high or you have a family history with that. These are the fibers you'll want to eat to keep your cholesterol down. Again, you can read through all these and see there are various benefits from a variety of different fibers, and all those fibers are found in a multitude, a variety of different plant foods. So you really can get the most benefit by having a wide variety of plant foods in your diet. I have some patients that say, oh yeah, I eat vegetables, but I don't eat fruit, or I eat fruit and vegetables, but I don't eat beans. Or completely avoiding grains, you're missing out on some nutritional aspects if you're not eating a wider variety of foods. But then again, if you can't tolerate certain foods, talk to your doctor about this, because there may be something we need to uncover that's dysfunctional in your gut functioning, and that would allow you to enjoy a wider variety of foods again. Specific food benefits, right? So I talked about the specific benefits per type of fiber. I'm just going to hit on a couple of foods just so you can see if you add these kind of foods into your diet, the benefits you can yield from them. So with chia seeds and flax seeds, you saw those listed as sources for several. In the lignin, cellulose, hemicellulose, and mucilage, all of those fibers are in chia and flax seeds. And the benefits here on the right, as we've gone through before, are plentiful, right? Preventing constipation, to being anti-cancer, to improving blood sugar and cholesterol. Really, it's a terrific fiber to get in. This one, I really caution you though to go slow when you're increasing your intake of these, because you can have some, difficult GI effects. So this one is a terrific thing to add. Just go slowly with it. We'll talk a little bit more about that in a second. Other specific food benefits. So in the legumes category, beans, peas, lentils, peanuts, those are really rich in mucilage and pectin, at least dried peas and dried beans will, and cellulose. So those are great things to eat to help manage the amount of fat that you're absorbing from food, to manage your blood sugar, lower cholesterol, and help you feel full longer, as well as removing toxic metals from your body. So legumes, beans, peas, lentils, again, if you can't tolerate eating those without getting gassy, talk to me about that. We'll try and figure out how to help your functioning work better. The onions, garlics, and leeks, I mentioned this a little bit earlier, they contain inulin, which is great to produce the short chain fatty acids that make our gut cells, our colonic cells, thrive and happy and produce energy for them. So there's not a lot of benefits to that, but they have a really important purpose. Brassica vegetables, again, cruciferous. I stumbled over that, but there they are. That includes things like cabbage, cauliflower, kale, Brussels sprouts, mustard greens, arugula. There are a lot of vegetables in this family. Remember, try to go for the older versions rather than the younger to get more of the fiber in there. But hemicellulose, cellulose, and pectin are in these foods, and great for having a laxative effect, helping to prevent constipation. Again, one more thing that can help move heavy metals and toxic metals out of our body. So great benefits from these veggies. And then finally, the last category, I did seeds. I did vegetables. Now with fruit, I'm selecting an apple for you. So an apple is a terrific, dietary source of fiber because it's got pectin, cellulose, and lignin. And lignin, remember, is the one that has those anti-cancer, antioxidant effect, as well as all of the things that the others help us with. So, this is, a way to get the dietary fiber that's going to help your body to thrive through some foods that hopefully you already enjoy, a lot of the foods that I mentioned. Now, how much do we need? The USDA is the government agency that sets the recommendations for intake of foods. They have something called an adequate intake level, and that's just, through various scientific studies and trials, they've determined how much is just an adequate intake to get you by, to keep you generally healthy. And so this one varies by gender and age. For males under 50, 38 grams a day, and a little less over age 51, 30 grams a day seems to be enough in older men. For women, it varies by age as well. The goals are a little bit lower than for men, but for women, it's 25 grams a day up to age 50, 21 grams a day over 50, and then in pregnancy and nursing, higher needs. So you need to eat more of that when pregnant and nursing. Now, another way that the government, that the USDA will evaluate food and establish an adequate intake level, or like a minimum intake, but then they also will establish an upper intake of, don't eat too much of this or you can have harmful effects. And with all of the trials done to look at this question, there has been no established upper intake level. So that means there's nothing that's going to be harmful with eating more dietary fiber, although for some people it can cause symptoms, cause them to not feel great, and that's a personal thing, but generally speaking, there's no harm with eating a really high fiber diet. The median intake in Americans, so we see the previous slide wanted men having around 38 and women at 25. But according to the latest survey, it's called a continuing survey of food intakes by individuals from 1998. The data showed that males were eating only about 16 or 17 grams per day, half of what they should be, less than half of what they should be. And females, same thing, 12 to 13 grams a day, a little less than what's recommended. Now, in my practice, I have optimum intake goals, and I just sort of, for these, I just round it up, right? For women, 30 grams of fiber per day, men, 40 grams per day. And we've seen evidence in the studies where we're looking at controlling high cholesterol and triglycerides. 50 grams of fiber per day is the best level for that. So these are, generalized. Ask me or ask your doctor what would be your individualized goal, but this is a good general amount to aim for. If you, though, are like most Americans and you eat too little, you need to be cautious, right? Do you remember this Saturday Night Live skit? Yeah, I do, and it was hilarious. And it's the danger of eating too much fiber too quickly, increasing your intake too quickly. Go slow. Add only, 5 grams or more of fermentable fiber per day, or else you're going to give those gut bacteria a whole heck of a lot of food to make gas out of. And so that can make us feel bloated and gassy, and maybe even make our stomach distended if we eat too much fiber too quickly. But if you are going to increase your daily fiber intake, do it slowly over time, and you should be comfortable. It shouldn't cause you distress. I did say another caution, though, was increased dietary fiber can create, again, not harm, but symptoms and side effects that are really uncomfortable. When you have IBS-D, which is irritable bowel syndrome with diarrhea, if that is caused by SIBO, which is small intestinal bacterial overgrowth, that condition, the small intestine is full of more bacteria than should be there. And when we add more fiber to our diet, they're going to ferment that more quickly than we should have that happen. And so people generally with this, when they eat, beans or cabbage or things that are high in those fermentable fibers, it can make them very ill. Burping, flatulence, stomach distension, acid reflux. It can be very uncomfortable to eat high fiber. So those folks, a lot of people just stay on a low fiber diet just so they'll feel better. But, you're really depriving yourself of the great benefits of eating a high fiber diet. So in that case, you want to get your gut condition treated so you could resume a normal diet. Diverticulitis, again, having a high fiber diet to start with can prevent the onset of diverticulosis. But once you've got diverticulosis, sometimes that can turn into an itis, which just means an inflammation. And when you're in that active inflammation state, more dietary fiber can be more uncomfortable, and you're actually generally recommended to avoid that. And then low fluid intake, if you drink low fluid, like maybe you've got a kidney condition and you're not allowed to have very much water in a day, you need to be mindful of the dietary fiber, because the way that those bulking agents work, right, when you eat some fiber and it bulks up your stool to make it larger and easier and more efficient to pass, if you don't have a lot of water intake, in your body, you're not drinking a lot of water, then that extra fiber can just become impacted, and it can completely stop your bowels from moving. And so it's really important, as you're going to be increasing your dietary fiber intake, that you're drinking plenty of water throughout your day. General rule of thumb is somewhere around a half gallon to a gallon of water a day. Ask your doctor for specific recommendations, but be mindful that can be something that can, again, it can be a health risk, actually. If you get a colon impaction, that can cause you great problems. So be careful, drink a lot of water. Okay, so you may be thinking, I really want to increase my fiber, but you don't even know how much you're taking in to start with, right? Here's a way you can kind of estimate. I've pulled together some examples of common dietary sources. And you can see I've arranged them so that on the top left at whole oats, that's the biggest bang for your buck, right? That's the most grams of dietary fiber per serving. And then at the bottom right column, raisins down there at the bottom side, that's kind of the lowest. So you've got a gradation here. The highest fiber intake to the lowest, contribution to your diet from these foods. So whole oats, I give you a half a cup as your serving size, because when you cook that, then you've got a cup of oatmeal, which is a nice, really nice big serving that I think a lot of people would have for breakfast. So oats, per just 1/2 a cup, you get 8.5 grams of dietary fiber. So that's a real bang for your buck. But again, this is why some people that don't eat high fiber, they'll eat oatmeal and feel bloated or uncomfortable because they suddenly put a lot more fiber into their intestine than they had before. Following down that column, the next highest, kind of, I guess, bang for your buck, or, grams per serving would be in the beans. So beans, peas, down, next below that would be whole grains. Whole wheat is, the serving size there is just one pita is about 5 grams. If you look at a lot of breads and you just look at one serving of bread, like one slice of bread, many of them have 1 or maybe 2 grams. So be mindful when you're eating things that are whole grain and intended to give you some extra dietary fiber, that you're looking at the serving size and how much is provided per. Because a nice, little whole wheat pita can be 5 grams of fiber, but most slices of bread are going to be 1 or 2. Quinoa, brown rice, oat bran, again, the grains have a decent amount of fiber, but about half as much as you get for the same serving of beans, right? Or even, half the serving. Beans are half a cup serving, where rice and quinoa and things are a whole cup. So again, just giving you the idea that those foods really are going to be the easiest to get into your diet to ramp up your dietary fiber level. Peanuts, almond butter, those nuts are really great. They've got 2 grams per serving. If you do almond butter, 2 tablespoons in a snack, that's a great level. Beans, okra. Now we're just getting into vegetables. So the whole other column is vegetables and fruits. And you can see that they don't actually provide a ton of fiber per serving. So it's pretty common when I try to, have conversations with patients about dietary fiber and, hey, do you eat enough fiber? Do you eat a lot of fiber? What do you feel about your fiber intake? People will give me the feedback of, oh, I eat a salad every day, so I think I'm getting enough fiber. Well, if you look here on that right side column, let's say you have, a whole carrot, you got a cup of romaine lettuce, you got a cup of kale, you got, half a cup of chopped celery and a tomato. That right there, you're probably getting, 5 or 6 grams of fiber. So a salad, 6, maybe 7 grams of fiber, depending on what all you're putting in it. So my recommendation, or a little, tip for people, is if you really love to eat a salad and you enjoy the vegetables in that, but you'd like to get a little bit more fiber, throw some beans on top of it, right? Put some canned beans, just throw a couple tablespoons on top, maybe throw some seeds or nuts. I love to put sunflower seeds on top of my salads. So yeah, throw some green peas in there. Load it up with a little bit of legumes, or maybe even, a couple tablespoons of cooked lentils, and that can really make that salad a much higher fiber and more, more beneficial for you. So you can, look up different websites that have nutrition information that can tell you how much fiber is in a serving of the foods that you eat all the time. So you can estimate on a typical day how much fiber you're getting in, and then slowly raise it up safely. Right? If you're like most Americans, you're probably getting between 12 and 16 grams of fiber a day, and you want to really get that up quite a bit. I do, again, in my handout, I provided this example. This is just one day's worth of meals for somebody. Actually, I said meals and snacks, but I don't encourage snacking with my patients. I actually really discourage snacking. So I took the snacks out of this, but I left that header. So please ignore that. For the meals, for this sort of diet, I made this one up with a specific patient in mind who was a vegan. So this diet doesn't contain any meat products. This is a vegetarian or vegan diet. And it's aiming for that 50 grams of fiber a day that's beneficial for lowering cholesterol. Now, I don't have a meat-free or animal product-free requirement for lowering cholesterol. Again, it just so happens this patient that I had in mind doesn't eat meat. But and also, he didn't eat meat already, and he had a really high cholesterol. So that sort of busts that myth that's still out there that people get high cholesterol from eating animal products in their diet, right? We know eggs don't cause high cholesterol. We know that eating beef doesn't cause high cholesterol. Really, it's about, your carbohydrate intake is the biggest impact on our cholesterol. So to lower cholesterol, really lowering those simple sugars, adding more dietary fiber, that's what we're aiming for. So with this example diet, you can see we aimed for 50 grams a day, and we almost got there. And it is through things like oats, lots of fruits, nut butters, hummus, black beans. So this is just an example of what that would look like. If you like the idea of this and you want to add in, some poultry or fish or beef or pork or something, you certainly can. And you'll still get, all the benefits of the high fiber diet, plus all that extra animal protein if you enjoy that. The next slide is from actually the government, right? From the Institute of Medicine of the National Academies. So they put out this publication that I was really enjoying reading in preparation for our talk today. And on page 392 here, they have an example of a day for an average man, so a 19-year-old man, and they were aiming for that 38 grams of fiber a day. And they accomplished it here through the foods that you see presented on the screen. Again, I'm not a fan of snacking. I really don't like what it tends to do to our insulin level. So, you can move those snack items up into a meal and just eat all of those items together, just in the context of like 3 meals a day. Anyway, that's not the topic we're talking about today. Dietary fiber is it. And this is just an example for men to get that 38 grams that's recommended for them. The next slide is going to be examples for how an adult female, 19 years of age, would get in the 25 grams a day of fiber that are recommended for her. And again, you can just see this isn't a restrictive diet. This is omnivorous diet, right? So you've got animal products in here. We've even got ice cream added in here. So this is, not a restrictive diet. It looks pretty generally healthy and pretty delicious to me. So there are a lot of great foods that contain really fantastic fibers that are beneficial to our body. The secret is to vary our diet, eat a lot of different plant foods, vary them day after day. But getting, a comprehensive diet full of fiber is really the best source. Again, as the researchers had indicated in their write-up, that it's the studies that we have showing the benefits of high fiber foods can't be, parsed out to where you'd say it's just the fiber that's benefiting. It's the high fiber food with all the minerals and vitamins and protein and other nutrients that it contains. So aiming for a high fiber diet is really kind of the best way to get all these health benefits. I have a few people that are live with me here today, and I am done with the presentation. If you have any questions, please feel free to reach out in the chat. I'll stay here for a couple of minutes to see, if anybody comes up with questions or concerns. But that is it for this presentation today. And as I said before, I do have a handout that I created that actually a lot of this information is directly taken from my handout. So you can have all the details that I spoke through. I'm sure you didn't memorize them as we went. So if you'd like that handout, please reach out to my office and we will share that with you. And I wish you good health and happy eating. And remember, if you're going to increase your dietary fiber from a low amount, go slow. And if you don't tolerate dietary fiber, really to any degree, if it makes you bloat and gassy and burp and acid reflux, things like that, there may be an intestinal disorder going on that should be treated so that you can then, enjoy the high fiber diet that your body was designed and made to eat. All right, guys. Okay, I don't see any questions, so I'm going to go ahead and sign off. Thank you for your attention today. See you next time.